Hi there. My name is Dr. Grant Stevens. I'm a board-certified plastic surgeon and a clinical professor of surgery at the University of Southern California. My practice is in Marina del Rey, where I'm the medical director of Marina Plastic Surgery Associates. I'm also happy to be the director of the USC Marina Aesthetic Surgery Program, as well as the director of the USC Aesthetic Surgery Fellowship. I've been in practice in Marina del Rey, California for 28 years, and I've seen thousands of patients over the years, both surgical and non-surgical. We offer a full range of aesthetic or cosmetic surgery procedures, ranging from breast augmentation and body contouring. We've also, over the many years, we've provided non-surgical laser and light-based technologies, injectables, and various other non-surgical services to both men and women. We have an area dedicated to non-surgicals called the Institute, and a special area dedicated to the treatment of men called Marina Manland. People come to see us for all things aesthetic. It's not just about surgery, it's also about looking and feeling their very best. Since April of 2015, I've been using Cellfina as a way to conquer cellulite in my practice. I've treated something less than 50 patients, and I followed them closely with postoperative photographs and frequent physical examinations. These women come in with various complaints ranging from dimples to full-blown cottage cheese. It's generally over their buttocks and their thighs, and I've actually graded cellulite into 5 different grades. That's helped me not only diagnose the types of cellulite, but would come up with a treatment plan that works with Cellfina. Today I'm going to be talking to you a little bit about cellulite in general, and also a new approach to treatment of cellulite. I'm going to go over the diagnosis and the markings, the anesthesia, and the treatment technique, followed by what I do post-operatively. We're also going to talk about the procedure itself and the post-procedure care and the impact it's had on my practice. I'll also be answering some common questions that you might have when you're considering bringing Cellfina into your practice. It's been estimated that 85% of women have cellulite, and the number I've seen is 54 million women have cellulite between the ages of 24 and 54, and that at least 22 million women are candidates for treatment. A recent ASAP's poll indicated that there's been an 86% increase in buttocks augmentation since 2014. Clearly, there's a lot more interest in the buttocks in that area. And now with Cellfina, we can also smooth the butt and take care of and treat the dimples and the cellulite. So for many years, we've tried all sorts of approaches to treat cellulite, and unfortunately, up until now, none of them have either worked or have had long-term beneficial effects. Cellfina combines highly advanced proprietary technology with the well-established procedure of subcision. Cellfina's highly advanced and proprietary technology is called TSGS, or tissue-stabilized guided subcision. TSGS is used to treat the primary structural cause of cellulite, fibrous septae. So you may ask, why should you choose Cellfina? Cellfina is the only FDA-cleared, minimally invasive procedure clinically proven to treat the primary structural cause of cellulite for results that last at least 2 years. Cellfina significantly improves the appearance of cellulite on the buttocks and the thighs in just one 45-minute treatment, depending on the patient and the areas being treated. With Cellfina, there's a significant rapid improvement. It is safe and effective and well tolerated. The results are reproducible and precise. There's a 96% patient satisfaction at 2 years. What I'd like to do now is take you through the pivotal study. This includes the 2-year data with 2-year follow-up. With the pivotal study, there were 3 centers and 55 patients were treated. These were all females between the ages of 18 and 55. They presented with moderate to severe cellulite on their buttocks and thighs. Their BMIs were less than 35. The primary endpoint was improvement of 1 point on a 5-point cellulite severity scale. Study results of the 2-year data included a mean cellulite severity score improvement from 3.3 at baseline to 1.3 at 2 years, and 96% of the patients were satisfied with the treatment at 2 years. In terms of tolerability, the highest pain scores were during anesthesia delivery with a 4.5 on average using a 10-point scale. At 3 days after the procedure, 71% of the patients had a pain score of 3.0 or less on the same 10-point scale. The most common side effects reported by patients in the pivotal study were soreness, tenderness, and bruising. These side effects resolve quickly with time. No serious adverse events related to Cellfina treatment were found during the pivotal trial. As with all areas of aesthetic surgery, aesthetic medicine, photography is absolutely essential. There's no better way to document the pre-operative or pre-treatment state of the patient. And I like to use 35 millimeter photography in a standard photographic room, something that's reproducible, and I can shoot the same shots both before and after the treatment. We shoot anterior, posterior, lateral, and oblique views with the patient in a flaccid state, not marked. And then we have her flex her buttocks, flex the gluteus muscles, and reshoot the pictures. And that way we can document both the flexed as well as the flaccid or relaxed buttocks and thighs. I also use Vectra, and I shoot the Vectra pictures and then reformat them in a three-dimensional fashion, both with normal color as well as the alabaster formula. And you can see the contour regularities with the alabaster, sometimes better than with the normal skin tones. After shooting the pre-treatment photos, I then do the markings. And after the markings are done, we shoot all the photography again, all the same views, at the same angles, same lighting, and the Vectra. After taking the photographs of the patients, we print both the unmarked as well as the marked photos. And I use the marked photos in actually planning the order in which I'm going to make my releases. Cellfina is a three-step process, and I'm going to take you through the diagnosis and the markings, followed by anesthesia delivery, and lastly, release of the dimples and release of the cellulite. Now, the beauty of Cellfina is it can be done in a regular treatment room. It doesn't have to be in an operating room. A clean environment with sterile gloves is all you need to perform Cellfina. As you can see, I'm now marking the dimples in this patient's buttocks with an indelible magic marker. It's important that it is indelible so it doesn't wash off. My assistant is holding the photograph so I can confirm the location of the dimples, make sure I get all of them marked here. And now the patient's flexing so I can spot the dimples that you don't normally see in the flaccid position. She's flexing here, and as you see, I'm going down the thigh here, the posterior thigh, by the banana roll or the buttocks crease, where I'm marking more in a transverse fashion than a circular fashion. There we see a number of transverse depressions, and we're going to release them at 90 degrees to these transverse depressions. We're now going to demonstrate the anesthesia, and first we prep the buttocks with betadine, and then we put a sterile drape over the buttocks and thighs and then cut fenestrations in it. We then place the vacuum handpiece over the lowest most depressions in the buttocks, and we're going to move from anesthetized area to non-anesthetized area, and that way we're going to crawl up the buttocks so that it's the least discomfort possible. In fact, many patients just feel the first stick, and then from there on they're perfectly comfortable because we buffer the anesthesia. You can see here that we're putting this proprietary needle in along this guidance track and administering between 8 and 10 cc's of the anesthesia with each stick. You actually can minimize discomfort the patient experiences as you move up the buttocks cheek because you're going into areas that are already anesthetized. You can see here that there are approximately 5 different sticks with each area, and the skin and sub-Q fat is actually sucked up, kind of like a hickey, and patients talk about it feeling like a hickey on their buttocks. And as I mentioned, it's very comfortable. My assistant there is injecting as I move across the buttocks. After doing the buttocks, I then anesthetize the thigh. And here, there's oftentimes a little bit of discomfort because there is no anesthesia on the thigh to start, so that you have to warn the patient there may be a small stick there in the posterior thigh as you then move your way down and chase the various depressions. We've now anesthetized the buttocks and the thighs, and you can see the areas of blanching from the adrenaline effect on her buttocks. We're now placing the device over the depression and using the micro-reciprocating blade to release the depressions. You can see here that it's actually inserted in the skin. It's an 18-gauge device there. The hole's an 18-gauge diameter. And you can see there I've just released that one depression, and it lifts right up and it's confluent with the surrounding skin. The guide here allows me to precisely release that depression. We actually can release at 6 millimeters and at 10 millimeters. And when we have depressions that are adjacent to one another or in the same area, we'll switch from 10 millimeters to 6 millimeters and maybe back to 10 again, so that we have multiple layers to minimize the tissue undermining and also minimize the fluid collection in the areas where we have adjacent dimples. You can see there's a little leaking of the anesthesia. It's a little blood tinge, and that's the same blood tinge anesthesia that we catch when we're dressing the patient. With traditional subcision, the practitioner uses a pickle fork, and it's a rather random release with various depths. The nice thing about Cellfina, and what separates it from simple subcision, is the precision with which one can release the dimples. I can release it at 6 millimeters across the entire area or at 10 millimeters. And it's that precision that is what allows me actually to have these fantastic results. Well, I've had all of the other technologies, and I can tell you with Cellfina, it's a local anesthetic. There's limited or no downtime. We're not putting a high temperature probe under the skin. We're not spending hours and hours to subject the fat to heat, and the cost is much less. And most importantly, with Cellfina, we have long-term successful results. With the other technologies I was using before, with lasers underneath the skin and creating a heated environment, we had temporary success, but the key word is temporary. We had no long-term successful results, and we are having them with Cellfina. You know, one of the terrific things about Cellfina in my practice is that I can see a woman during a normal patient day, and if she wants, she can be treated that very day. I can work her into the schedule, add her in that very day, or I can schedule her to do her after a day of surgery. So I find that on many surgery days, I'm coming back over to the office and then doing Cellfina treatments. They're fun, they're easy, they're very efficient. The staff takes the photos, I mark the patient, we take the photos after the markings, we put her on the table, anesthetize her, treat her, put her in a dressing, and send her home. And they think about it incrementally. I can add at least one a day. Let's say and I'm charging between $4,000 and $6,000. Let's say I just add 2 a week. You can do the math, that's about $10,000 more a week, or $500,000 of added top-line revenue with simply releasing 2 cellulite cases a week. As a physician, as a surgeon involved in cosmetic medicine and aesthetics, the things I consider when embracing a non-surgical technology is very simple. Is it safe? Does it work? And are the economics good and healthy for the patient as well as myself? In the case of Cellfina, we know they're evidence-based and we know that they're safe. They have long-lasting, effective results. Cellfina is the only FDA-cleared technology with results up to 2 years. It provides the service to the patient at a fair price, and I have a 70-80% profit margin on the device in spite of the consumable. But with Cellfina, I have a corporate partner that comes to my office and helps me with both the marketing and the sales and the development of my practice. These people are in my office frequently. They're invested in my success. They want me to consume and to utilize their product, so they want to help my practice grow. They help me attract patients and stay busy with the technology. I've recommended this Cellfina treatment to my family, to my friends, and I can absolutely recommend it to my colleagues. Finally, there's a safe and easy, affordable way to treat cellulite and generate happy patients that come in for other procedures and other treatments.